Let's try that again. Fitness and rehab influencers would have you convinced that the reason for your postural imbalances are due to tight hip flexors. But I hate to break it to you, for many people, and this might be you, actually having weak and poorly integrated hip flexors is what might be causing your postural imbalances. And worse yet, some of the work you've been doing to either stretch or inhibit your hip flexors might just be making things worse. So in this video, we're going to talk about what the hip flexors are, what they do, how to identify if you've been overdoing it with the inhibition and stretching exercises, and teach you what to do instead to both work on strength and then integrating this hip flexor function into our day-to-day and trainable movements. So without further ado, let's go ahead and jump right in. All right, so I got my buddy Mr. Phibbs to help you demonstrate. First, let's talk about what hip flexion is and where the hip flexors are, what muscles they are, and which ones we're going to talk about in this video. So, hip flexion is really any time that we're bringing the leg into a closed position with respect to the pelvis. So we'll see here at the hip, this joint closes as we bring the leg up like this. This is hip flexion in what we would consider to be open chain. Then we can also have hip flexion in closed chain where the pelvis moves on top of the leg. This is going to happen during motions like an anterior pelvic tilt or when we're doing motions with the foot fixed on the ground. So imagine if I was doing a hinge motion here, I'm actually tilting my pelvis forward on top of my other legs. I'm still moving into hip flexion, although the feet are fixed rather than moving in space. There's going to be a lot of muscles that do this, and we're really going to divide these into two categories, which is going to be important in a second when we talk about which muscles we need to get to be a little bit more active, strong, and better integrated. So we're going to have superficial muscles as well as deep muscles here. The superficial muscles are going to attach just onto the pelvis and then onto the leg. So if we look at our rectus femoris, that's a quad muscle that attaches right here on the front of the pelvis, comes down to the top of the leg. We also have the sartorius, which is going to attach just a little bit higher, and then come down and attach on the inside part of the knee. Those are both going to affect leg movement with respect to the pelvis and pelvis movement with respect to the leg, but they're not going to directly act on the deeper parts of the pelvis or the lumbar spine. Now, when we look at deeper hip flexors, we have the psoas muscle, which attaches to all these lumbar bodies and discs, and then comes down to attach to the leg. And we have the iliacus muscle, which is on this inner surface of the pelvis and then goes down to attach to the leg. You'll often hear these muscles considered together as your iliopsoas, and these are your deep or primary hip flexors. Now, the biggest difference here is these are going to have a much bigger effect on posture because they have much bigger attachments to the deeper parts of the pelvis as well as broad attachments onto the lumbar spine and even up into the diaphragm. So in some cases, these muscles are in a position where they really are too short. And when people talk about tight hip flexors, they're usually assuming that the reason we feel the sensation of tightness is because they're short. So if you imagine with the attachments that I just said here on the spine and the inside part of the pelvis, as well as the leg, if we brought those together, then we get more of an arch in the back, which is lordosis, and we get more of an anterior pelvic tilt in the pelvis. Now, for some people that look like this when they're standing, certainly something to help get those hip flexors into a better position is a good goal. So if that's you, then some of the traditional advice will probably work okay for you. But if you're a person who actually has less lordosis in the back, so less of our natural curve here, and a tucked under pelvis that you might see in something like a sway back, then that advice probably isn't going to work for you. Now, what we need to understand here is that good posture, balanced posture, is going to be the ability to get your head, rib cage, and pelvis to all stack over each other in this relatively vertical position. If this is your resting position, then you probably have pretty good posture. And during movement, if you have access to this position, it means it's going to be easier to move into other positions in space. So if you have this as your resting position, you can move back, forward, side to side, and rotationally. If you can't access this position, then you're going to have a little bit more difficulty with that. Now, in order for us to get the head, the rib cage, and the pelvis to stack over each other, we need curvature in the spine. So a lot of times people focus on curvature as though it's a bad thing, but we actually need these alternating curves. Down here in the lumbar spine, it's going to be called lordosis, or an inward curve of the spine. Up here in the thoracic area, it's going to be a kyphosis, or a backwards curve of the spine. And then up here in the neck, we're gonna see a lordosis again, another inward curve. Those alternating curves make us able to stack cranium, ribcage, and pelvis over each other and have a very efficient, standing, balanced posture. And to some extent, this is also going to be what we need to be able to rely on in sitting, although there are some differences there. So for a lot of people, the problem comes on when they have that tucked under pelvis and a reduced curve in their low back to start with, and then they're perceiving tightness in their hip flexors, maybe because they're swaying their pelvis forward and they're actually stretching these muscles too much, and then because of different advice that they hear on the internet, they just go ahead and start working on activities that either stretch or inhibit these muscles that are already in a position that's compromising balance throughout the system. So in this case, what we want to learn how to do is actually how to create a little bit of an arch in the low back, maybe even move into a little bit of anterior pelvic tilt, and be able to not only do that in isolation, which we'll cover in a second, but also in an integrated fashion during movement. Now, often what you'll see with these individuals is when they go to squat or hinge, they have a lot of low back rounding as they get to the bottom. So they might shift back like this, and then you might see their back actually go into a rounded position. Same thing can happen at the bottom of a squat, and these would be the people who would be accused of having butt wink. Now, we need to be able to understand that psoas muscle and that iliacus muscle actually pull the spine forward into a normal amount of lordosis. And if we don't have the ability to do that, we need to create that ability through some sort of an exercise exposure. If you're getting value from this video so far, consider liking this video and subscribe to the channel. If you subscribe, hit the notification bell so you'll know when I upload a new video. And if you think someone else could be helped by this video, go ahead and share it with them. All these things help the algorithm to eventually help me help more people. So now we're going to go through two different exercises that you can do. The first, which is focusing on open chain movement of the leg relative to the pelvis. This one's going to be a great one to develop some strength. We're then going to go through a closed chain example that you can use as well. That's a little bit lower level. This is going to help you to do the same thing, starting to get a feel for where this muscle is at. The first one's much more progressible, and we'll go through how to do that. And then after that, we're going to go through a final exercise, a squat, where we're going to integrate some of this mind-muscle connection into more of a functional movement. So let's go ahead and dive into that. All right, so this first exercise is not exciting at all, but there are some nuances here. So very simply, if we want to work on improving our activation of the hip flexors, we can simply practice flexing the hip. I know, it seems kind of obvious, right? But remember, one of the things that we're running into here is that when we move into hip flexion, so when we're in that squat, when we're in that hinge, what's happening is that low back is rounding too much. So a lot of times we're moving into hip flexion, but we let that back flex, right? So if we are in that situation, what we want to be careful for is as we're lifting the knee up, we don't want this to round backwards. We don't want the pelvis to tuck backwards, but we want to maintain that pelvis in a little bit more of a neutral position or even slightly arched. So what I would do in this initial position is think about getting your weight evenly distributed between the toes and the heels, about a 2-to-1 ratio from heel to forefoot. Then from here, we're going to almost think of just creating a tiny little bit of an arch in the back. Then we're going to maintain that as we lift up with one leg, hold, and we can even apply some resistance there to further get that to activate, and then come back down. Now, this is a little bit of a nuance and maybe even a less important cue, but what I like to focus on as well in this side-to-side plane is avoiding any tendency to hip hike. So as I come up, I'm doing a slight arch in the back, I'm getting a little bit of that lordosis, anterior pelvic tilt, holding on for balance if I need to, and then as I'm coming up, I'm going to note at which point the pelvis on that side wants to hike up. I'm going to prevent that from happening, but don't be afraid to arch your back kind of hard and push that knee up kind of hard and get the feeling of a pressure right here on that hip crease. That's where your psoas and iliacus cross the front of your pelvis, and if you can feel that with a little bit of resistance, then you're going to be able to establish that mind-muscle connection with those deeper muscles. Now, one thing that should be noted here as well is that when we have superficial muscles versus deeper muscles usually are going to respond better to cues that are based in visualization. So what we mean by that is if you can develop some sort of internal diagram in your brain about where those muscles are, and you can imagine those attachment sites pulling together, that's actually going to help you create this feeling of where those muscles are, because in general, deeper muscles are going to give you less sensory feedback than the more superficial muscles. So while you're doing the exercise, what I like to think about is allowing that spine to come towards the attachment on the upper leg. So if we take the left here as an example, if you imagine that we get an attachment right here on the side of the spine, and then we cross here and attach into the upper leg, then as I'm bringing the leg up like this, I'm actually imagining the pelvis and the spine actually moving towards that leg at the same time that the actual leg moves towards it. And so if we were to approximate that, they move closer together, and then the further we get up, we actually get the spine slightly turning away. Now, if you want to dive deeper into this, we cover this in my program, Total Body Restoration, where we talk about all the biomechanics of the entire body. All right, so this second exercise here is going to allow us to establish this ability to move the pelvis on top of the leg in a closed chain fashion. So if you're starting out and your back's rounded, I'd encourage you to let that sink down. So let gravity pull your back down towards the table and reacquire the ability to arch into a little bit of a lordosis, okay? Then what you're gonna practice at first is just maintaining that lordosis as you use your hands to push backwards, okay? You're gonna stop this at whatever point you feel like your back's going into a rounded position. If you need to here, I'd suggest using a visual reference, because a lot of times we might feel like we're arched, but then we go to look at the back and it's actually quite rounded, okay? So we're gonna arch a little bit here. We're gonna almost imagine those hip flexor attachments on the spine pulling towards the upper leg as we're pushing back. And the better we get at this, the more we're gonna be able to feel our ability to maintain that lordosis, maybe even a slight anterior pelvic tilt, and almost pull ourselves down towards that upper leg. And when we do this, if we get it right, we're gonna feel this feeling in the back of the hips and the butt, almost like this area is opening up a little bit. So at first, you can just keep tension in the back, use the hands to push back, but then as we get a little bit more awareness here, and we can visualize the attachments on the spine and the inner pelvis, we can imagine pulling that down towards that upper leg, and we'll feel the upper leg rotate inward slightly with respect to the pelvis, and that's us getting that nice proximal femoral internal rotation as we maintain a bit of anterior pelvic tilt and lordosis. This is going to be an absolutely amazing variation for those sway back individuals that have too much rounding, or really anyone that's experiencing too much rounding as they move their pelvis into greater degrees of hip flexion. All right, so with those first two exercises, you should already feel that you can begin to isolate the movement and feel where that hip flexor is during an open chain movement, as well as start to feel what it's like to get the spine and pelvis to kind of pull down towards those upper legs. Now this exercise is where we take that integration to the next level. And that's gonna be within the context of a squat. So like I said earlier, a lot of people when they're squatting that have this issue, they might actually be able to get full depth, but what you'll see is that we get a lot of rounding here in the lumbar spine as we're coming down into that position. Now, there's no problem with that, right? If that's you and you can do that, that's totally fine to train, but if you can't come down in a little bit more of an upright position like this, then chances are you can't maintain that lordosis and you're not in as stable of a position as you could be. So with that being said, when we're doing this squat, we want to imagine that those attachment sites here on the front and side of the spine, as well as the front of the pelvis, are literally pulling us down.
Pulling us down towards that upper leg. Whoops, a lot of valgus there, huh?
Let's try that again. So as we come down, we want to think about the attachment here on each side of the lumbar spine, as well as the inner pelvis, literally pulling our pelvis down between the upper legs. And as we do this, what we should see from this kind of side view is that we maintain the ability to have a little bit more lordosis in the spine as we do that. So we're not getting that butt wink as we come down, but instead we preserve this curve. So to start, we could do this holding on to something if we need to for balance. But kind of once we get the feel, we probably won't need to do that. We want to get into this initial position and just imagine in a really subtle way that we have the attachment sites on either side of the spine, pulling down and slightly forward. Same thing with the inner pelvis, just thinking about that upper leg, getting a little bit of compression with respect to the pelvis and that lumbar spine. Then once we feel like we have a little bit of an arch, it's simply going to be continuing to pull down in that same way as we enter into the squat. And as we do this, we might push the knees slightly forward and maybe a little bit out to create some space. as we're coming down here, we should go as low as we can and monitor again for when we lose that arch. And if we're really thinking about pulling down into that position, we should be able to get pretty low. And once again, feel the femurs moving into a little bit of that internal rotation as we get to about 90 degrees. Then from here, we can simply practice holding that a few seconds, pulling down, holding a few seconds here, then maintaining that as we drive down and push up to the start. Then once we have the feel for that, we can actually take this cue and use it in a number of our other variations. And if any of these variations are more tolerable, feel free to start with these as opposed to the squat. So for example, if I'm doing a split squat here, I can think about that hip flexor here right now, specifically on the left side, pulling me down and forward a little bit towards that upper leg, and then continuing that as I come down. So letting the knee and hip bend, but pulling down towards that upper leg with that inside part of the pelvis, inside of the spine, and then pushing back up as we maintain that activation. So now that we understand the exercises, let's talk about how we might integrate this into a program. So that first exercise was mainly looking at strength, right? That's something that we could scale up over time. So starting maybe with just body weight, learning to get a little bit of mind-muscle connection, we can very quickly start to add load to this in some way. Right? So we could put something on the foot to add a little bit more resistance and then increase that week to week while maintaining the same amount of reps. In terms of how many times to do this a week, probably somewhere from 2 to 3 is going to be a good target. And this is something you could put right at the beginning of your program to act kind of as a warm-up / activation type drill. Now, once you have that mind-muscle connection and you have adequate strength and even strength between your left and right sides, then you can really focus just on the integration piece here. Now, I should say that you don't need to delay working on this integration piece. You can go ahead and start using this right away. But once you have that good mind-muscle connection and a good amount of baseline strength, you probably no longer need to do those isolation strengthening exercises quite as frequently, unless it just feels really good and you want to. So kind of moving on here or being done in conjunction, you also want to use something like that second exercise, or at least the skill you get from it, to be able to integrate the feeling of those hip flexors, stabilizing the lumbar spine during your trainable movements. So what do I mean by this? Now, any trainable movement is really just a movement you would do in the gym that's scalable and loadable. And the good news is that in the context of those movements, most of them are going to have some degree of hip flexion in them. So remember, hip flexion is anything that either brings that knee up towards the chest and closes that angle between the leg and the pelvis, or anything that brings the pelvis back and makes it flex with respect to the upper leg. So most of our activities in the gym are going to be feet planted type activities where we're moving the hip towards that flexed position. So squats, split squats, lunges, hinges, deadlifts, they're really all fair game for working on this type of coordination. Now, once you understand how to coordinate this and feel this in the context of movement, you're gonna find that things really smooth out and start to feel better. And then your brain over time is gonna automatically use this kind of feeling just as a pattern of habit. So you won't really have to think about this as you go, but in the initial stages, what you might do is use this intentional conscious thought process during your lighter sets or during your warm-up sets, and then during your heavier exertion-based sets where there's just like really too much to focus on, you can pretty much let the form be whatever it is, and this way a certain percentage of your program will be done with the ideal kind of form that you're going for this goal, but you won't rob yourself of the overall stimulus by making any sort of rules like, I can't go heavy unless I have this exact form. That's usually actually not that productive, because the reason that we're in the gym is not just to improve mobility, but also to improve other factors like strength and endurance, which are actually going to interact with our need to use asymmetrical strategies. So we don't want to limit the overall stimulus just to work on the mobility side, but finding a nice balance between the two is the best target. All right, that is it for this video. Remember, focus on the strengthening aspect and the integration aspect. And if you want to take this to the next level, consider joining Total Body Restoration. This is an education program where I'm going to teach you how to integrate everything I know about posture and breathing into training so you can move and feel your best. If you're interested, go ahead and click at the link below. As always, thanks a lot for watching. And until next time, peace.